I want you to get a good look at this patent, Anti-tumoural effects of cannabinoid combination. The inventors are the people that are in Spain at the University of or Complutense University, I should say, in Madrid. And you can see the ES next to that. That's all indication of where it was made in Spain. Guillermo Velasco, Manuel Guzman, they're all on YouTube, as well as other videos that I have here describing some of the anti-tumoral effects of cannabinoids. One of the documents that I uploaded, or not uploaded, but one of the documents I have a video on concerning the anti-tumoral effects of cannabinoid combinations, or cannabinoids, is a publication that came out in 2016 written by Guzman and Velasco. So, and a couple of others I believe are on that list. So the next thing down, the assignee of the patent. So who owns this patent? GW Pharmaceuticals and Otsuka Pharmaceuticals over in Japan. So you see the GB, that's Great Britain, the JP, that's Japan. I want to go down also, you'll see this application number, the 124, in the last 3 digits right down here. I call this the 124 patent because it ends up getting, that's the application number. And so they submitted this application to the United States, and we actually granted the patent for them to use, at least in the United States at some point in time. So this patent is available, not available for the public to use, but available for GW to begin pursuing making medicines, and we're going to get into that in a moment. So I just wanted to give you like the screenshot of the front one. Here's the excerpt I wanted to pull out of this. The present invention relates to the use of a combination of cannabinoids in the manufacture of medicament, or any manufacture of a medicament. So a medicament is just a medicine form, so it depends on the route of administration, whether it's pill, sublingual, or mucosal. So those are all different ways of doing it, but by calling it a medicament, those all are implied or can be used, instead of just saying to manufacture like a oral solution or something like that. They just call it a medicament. So it's useful in the treatment of cancer. In particular, the cancer to be treated is a brain tumor, more particularly a glioma, and more particularly still glioblastoma multiforme. And preferred combinations, the preferred cannabinoid combinations comprise of THC and CBD, so tetrahydrocannabinol and then cannabidiol. So there's another quote that I want to go ahead and read down another page, but I want to focus here on how it can be used to treat a brain tumor. But the title of the patent is Cannabinoid Combinations, Anti-tumoural Effects of Cannabinoid Combinations. So we're not just talking about brain cancer alone, and we're not just talking about THC and CBD. We're going to include CBN, THCA, CBDA, CBG, all these other cannabinoids, and also some of the terpenes that activate the CB2 receptor. Let me see, what is it? Beta-caryophyllene activates the CB2 receptor. So this is just, right here, a little rundown, whatever. Now, I messed up here. I have part 1 up top, and then I have part 1 up top here, but I have fixed it now. So this is one of the tables or examples in the patent that they show. This invention relates to the use of a combination of cannabinoids, particularly THC and CBD, in the manufacture of a medicament for use in the treatment of cancer. In particular, the treatment of cancer is a brain tumor, more particularly as a glioma, particularly still as a glioblastoma. So I believe that I didn't do this twice. The present invention relates, THC, CBD. Yeah, so this quote comes from another location within the patent. It's pretty much the exact same thing that was set up here in the abstract, or like the intro. So it's just a reiteration of the point of this patent. The best part of this patent, and I'm going to have to find some of the quotes and make another slide for this, but it talks about having the ability of cannabinoids to kill certain tumors whenever it comes to brain cancer. One of them was reduced, their volume was reduced by 80%. They call it a wild type cell line. So that was reduced by 80%. This table shows how the astrocytes, or the U87MG astrocytoma cells were xenografted into a nude mice, and the test compounds were injected peritumorally at a concentration of 15 milligrams per kilogram per day. So whenever people ask me, how much should I be taking? Rick Simpson says to take a gram a day, but this study would say 15 milligrams per kilogram. So if I weigh 60 kilograms, then I'm going to be up in the 900 milligram area. It wouldn't be 1,000. But again, this is according to this study. If anything, because the anti-tumoral action is dose dependent, dose and duration dependent, you'd want to do more than that if you can handle it. But this was done for 2 weeks. Where does it say it? I guess, 15 days right here. So this is the volume of the tumor using THC in a nude mouse, where a brain cancer was taken and put into a nude mouse, and then it's allowed to grow there to see the timing and all this kind of stuff. So this is following 15 days after treatment. So you have the vehicle, 9.2 is the tumor volume, and the THC CBD extract down to the bottom is 4.8. So that's almost a 50% reduction in tumor volume after 15 days of treatment using CBD and THC at a 1:1 extract ratio. So for myself, by 15 days, and for most people, by 15 days, you've already been butchered, you've had your cranium opened up, you've had surgery or resection of the tumor, you're signed up to do chemotherapy and radiation. You might have even started chemotherapy and radiation, so now you're being butchered. You've already been butchered, now you're being poisoned and burned, and it's already past the 15 days, when in reality we should start this immediately. So, if we always give until we know more, we always give basically the statement, the disclaimer that this doesn't necessarily work in every tumor. But the whole point of this whole, researching cannabis as an anti-tumor agent is to be able to at least lower the volume of the cancer. So even if we were able to lower the volume using just pure THC, a THC extract, that's still lowering the volume from 9 to 5 to, it goes back up to 6, and then down to 4. So if the goal is to get rid of the tumor, even if the cannabinoids don't get rid of the tumor, it still lowers the volume of the tumor, so you would need less radiation, less chemotherapy, a smaller surgery, and you'll have a better outcome. You'll have less medication to take afterwards. You might have a longer survivability or more probable survivability beyond what the prognosis or diagnosis says. And so this is a big one. 50% reduction in 15 days. That's impossible with chemotherapy and radiation. And this is a holistic measure. We can use CBD and THC, and whenever CBD is used, it has a light affinity, they call it. It barely attaches to the CB1 receptor. I would say it doesn't attach. It just kind of sits on. And so the THC's high or euphoria is mitigated by the CBD sitting on the receptor. So the THC can still be, and CBD can be effective, even though the CBD will mitigate the high and lessen the high. I mean, we call it a high, but you get high off of painkillers. I've been more high and uncomfortably high on painkillers after a procedure than I ever have been on a cannabis extract. So whenever we say these things like the euphoria aspect of it, we don't need to be like, oh, we can't do this because you get euphoria. Well, whenever you do chemo, you get chemo brain. And I'll let y'all look that stuff up. But basically, it gives you brain fog. And so it's either you're going to get a little buzz, a little high, or you're going to get a little sick and possibly get brain fog and all that kind of stuff. And if you go with chemo or radiation, you can get neurological necrosis. So this is the biggest one for me. 15 milligrams per kilogram per day is the dose to work up to as far as the CBD THC tincture extract. And this is the goal as far as our position right now, or my position within the CannaCare project, is that I want to be able to get the doctors to have access and further this information right here, to further the data, to keep going with more than just THC and CBD, and see how much volume of a tumor we can decrease using cannabinoid ratios and combinations. So that's what I wanted to get over to y'all for today, and I'm going to wrap this up. It is 9 minutes. Oh wow, okay, so this is pretty much a 10-minute video. I love y'all. Check you later. Got questions? Please do ask, and share these everywhere you can. It's not about my recognition, it's about this information being put out there. So again, love y'all. We'll catch up and enjoy the video. Actually, I should say enjoy the next video or other videos you watch, and thank you for watching this one. Subscribe, hit the bell button. That makes YouTube more aware that this is information that people want to know about. So feel free to do that, and actually not just feel free, but please do that. It's for the cause. So check you later.